Hi, I'm Joey Perez. You may have seen me on over 20 national big commercials, or looked at my McDonald's I'm loving in bags and cups, seen by billions globally. Today I'm here with Dr. Matt Hammett, and talking about chiropractics and wellness care. New Life Family Chiropractic Center was established in 2003. It is a husband and wife team approach to family wellness care. Dr. Matt's wife, Dr. Trish, holds a diplomat degree in pediatrics and pregnancy care. This is the highest degree in this area in chiropractic, and she is the only diplomat in NWI. Dr. Matt is currently studying for the wellness certification under the direction of Dr. James Chestnut and the International Chiropractic Association. Both of these programs are the most advanced in chiropractic in the areas of wellness and family natural health care. They have co-authored a best-selling book for the chiropractic profession, have been featured in many chiropractic publications, won numerous awards, and in 2014, Dr. Matt was nominated for the World Top Chiropractors Award in Merrillville, Indiana. He is also the creative director for the Five Pillars Project and author of a free ebook, The Pillars Blueprint. We are here today to talk about his practice philosophy, and we will get to hear from some of his patients as well. Dr. Matt, the primary difference that you make in this office is that you truly care, and you will go the distance to make someone better, no matter what it takes. Why is that? That your approach is so effective? Why is it that even after your patients try the medical route, they finally get relief under your approach?
Well, the answer is simple. What we do works. It works because when you change your cellular environment and restore it to its natural ecosystem, you always change physiology toward health. Leave a forest alone, it will naturally grow again. So the less man intervenes with synthetic and man-made chemicals in certain situations, the better and healthier the organism becomes. Nature needs no help, just no interference.
I love that expression. Can you explain your practice philosophy and what you mean by prevention and wellness?
My practice philosophy is actually grounded in basic science and our new understanding of the new sciences like epigenetics. We need to take a moment to define some terminology before you can begin to understand. Because we are talking apples and oranges. You wouldn't ask me to explain how oranges got the red pigment. It doesn't make sense. So let me explain what I mean. The terms we see in hospitals or Western medicine facilities are being misrepresented. And let me explain what I mean by prevention and wellness, the way I use it. Western medicine uses these terms based on Newtonian philosophy, which is mechanistic philosophy or Newton's laws. Holistic medicine uses these terms based on quantum physics, which is much more practical and closer to reality. Physiology is quantum, meaning everything happening has its purpose and is closely linked up like a huge spider web. And we really have no way of mapping and understanding what happens when one protein is altered chemically at the quantum level, which is what medicine tries to accomplish. And this explains why every synthetic medication has its list of side effects, even death. And unfortunately, according to the National Institutions of Health, is altering our DNA epigenetically down multiple generations, causing genetic mutations and mistakes, tumors, and cancers, a fact that you never heard about. The use of the terms prevention and wellness in the Western medical model is very confusing. First of all, to give you an example, they use a mammogram as a preventive tool, but it doesn't prevent a thing. They call that prevention. However, a mammogram is an early detection tool. It doesn't prevent anything. And that is true for every test they call prevention. When they use the term wellness, they impose some idea that taking synthetic chemicals or medicine for life somehow will make you well. There is a purpose for medicine. It may be needed to save a life or in place of a missing organ. It is beneficial at a time of crisis and sickness intervention. But focusing a treatment plan by prescribing medication for life will not add value in the long term for the general population. It certainly will not make you well. If you subscribe to this type of treatment plan, the medical wellness plan, other areas of your body will begin to break down, and they will keep supplying more drugs to treat your new symptoms, and on and on. This idea is not wellness, and certainly not prevention. Wellness and prevention, the way I practice it, goes like this. Man dominated Earth for thousands of years. Cancer was little to none. Only 50 to 100 years ago, right? Especially before World War One. So the environment has changed drastically the last 100 years because of the chemical industry. The way to fix this problem is by taking a short history lesson on humanity prior to World War One, before pesticides, herbicides, chemicals, and drugs. We know how our ancestors lived, their lifestyle, their 5 pillars, as I like to call it. All we need to do to live toward wellness and prevention is to mimic Mother Nature like our ancestors. And thanks to the Human Genome Project, we have a greater understanding and new evidence based on science called epigenetics, and now the ancestral health movement. So the integrative medicine approach that I like to use, medicine is useful in sickness and crisis intervention. It can save a life. It can help you live many years even without an organ. However, as great as medicine is in times of crisis, in terms of chronic illness, it is a failing battle. In my opinion, for this failing battle is that Western medicine bases its focus from the study of pathology, not healthology, a term not even in the dictionary. Healthology, or the study of health, comes from the genetic requirements for a particular species, which we are learning more and more in science. And these genetic requirements for our species, which can be quantified and scored scientifically, I've summarized and offer a simple solution rooted in lifestyle change. And I call them our 5 pillars. They are how well you eat, move, think, connect, and cope with stress as a member of the human species. What you have to understand is that the end goal needs to be achieved to achieve health and not just get out of diagnosis or illness. Nothing in Western medicine measures true health because we have not had a baseline for studying health, period. We know lifestyle is a major factor, and I have simplified an easy way to remember it. Anytime we use our 5 pillars that are not genetically grown for humans, that's a stressor. And it moves us away from health. It has nothing to do with our symptoms or how you feel. It has everything to do with understanding our genetic requirements. And anything we do against our genome, so to speak, is a stressor and moves us away from sickness. Therefore, integrative medicine, as I see it, is working with a crisis sickness provider to save a life and also a health provider to get them working toward health, not just out of the sickness. The secret to our success in this office is this. When you combine factors that correct interference to the nervous system, such as subluxation correction, or misaligned vertebrae, that vertebrae aren't moving properly, removing toxins from our food, and the ability to traumas that are built up in the central nervous system, the body begins to heal and revive. That when you put healthy lifestyle practices like following the advice I laid out in the Perez Blueprint, people begin to thrive and flourish. Practices like vitalistic home nutrition, positive mental attitudes and meditation, exercise, regular chiropractic care, and stimulating neurological behaviors. We are confident we can prove this, and along with the other groups that are researching similar practices, brings a new model into a healthcare industry that has been resistant to change and is primarily profit motivated. It will ensure a patient who has experienced a catastrophic trauma, but will also provide a system of care and nurturing that enhances the human experience while saving money and improving performance and satisfaction. And keep this in mind, side by side, the education between chiropractic and medicine is more similar than you know. Guyton's textbook for medical physiology is the same textbook for chiropractic as it is in medicine. Kumar's biochemistry textbook is the same textbook, and on and on. Basic science is basic science. The difference between the two professions is paradigm. Paradigm is everything. Provider discrimination and cultural bias is diminishing, but still present. Look, in my office, I not only have worked with MDs and DOs, I've seen their entire families. That includes babies. Not kidding. That first 6 months, a newborn baby grows faster than any other time in their life. It is such a critical moment for them to get checked by a chiropractor, even for cranials. Excuse me. The birth process is traumatic, and newborns are delicate, and the pressure needed to create such significant change for a newborn is similar to touching your eyeball. The old paradigm is changing, it's evolving. The new science is helping us to relate better with Western medicine and to explain what we do as chiropractors better. This integrative approach is the future, and we don't need to wait 50 years to benefit. We can begin today and reinvent healthcare.
I'm loving it. Let's watch this short video and hear it straight from their patients.
Had an accident, a home accident. I'd fallen down some stairs, broke a tooth, got a bump on my leg, and thought, oh, I'm just fine. And several months later, I couldn't get out of bed. I had an MRI done. I had an EMG done. I had all kinds of x-rays. I did go to a pain doctor, but the only thing I got were pills, and I didn't want that. I wanted to be able to do something that would enable me to get back to being normal. There was a health fair at our school, and we went there, and there's this young man standing there with this strange looking outline, a form, and he said, I could probably tell you how you are or how you feel right now if you just come up on the platform, which I did. And then he proceeded to tell me within a minute exactly what the doctors had told me, which was amazing. And I decided that I would go to see his wife, Dr. Hammett. And I started seeing her shortly afterwards, and it took a little while, but she got me to the point where I was able to move around without pain, and she kept me in line. And in the meantime, I have also been to see Dr. Matt, if Dr. Trish is there, and he does just as good a job in getting me back to being almost pain-free.
Yeah, don't delay. If my philosophy and approach toward preventive health and wellness fits you, call our office today. Sometimes having a primary care physician does not prescribe medication and uses natural means to heal the body is just what the doctor ordered. Maybe you suffer with a musculoskeletal problem like a back, neck, or joint pain. Maybe it's something totally different. You just want a doctor with a natural and safer approach. Maybe you simply want to come for pain management only, and simply at this time in your life, not interested in wellness or an integrated approach. Whatever the case, our office is here to help. If we determine your case needs appropriate sickness crisis care treatment, we can make the right referral for you, and preferably find one that understands our treatment plan and goals, an integrative approach. So your experience between offices is supportive and not apprehensive. We are not here to make a judgment about you. Think of our office as a GPS system, where we are always here to help you get right back on that route. From time to time, we all take the wrong direction and need our GPS to help find our way. Whatever your philosophy, religion, or background is, we see all types of people from birth to over 100 years of age. No kidding. You are always welcome in our practice.
Yes, take the fear out of your healthcare decisions. Let these doctors help show you how. There may be a safer natural approach to your problem. Most insurances cover chiropractic care, and if you have a high deductible on your insurance, a natural approach may be more affordable for you. Oh, and by the way, often are more effective than the medical approach. Remember, the natural healing arts have been used for thousands of years and a major approach in Asia and India, which populates almost 60% of the globe.
Yes, and chiropractic care is a great tool for kids, as more than half of our practice is dedicated to treating children and pregnant moms. Look, spinal manipulation was used for children and babies 7,000 years BC. The father of medicine, the father of surgery, the father of osteopathy, and the father of chiropractic all wrote and used it extensively. Today, chiropractors handle over 98% of spinal manipulations, we mildly refer to as adjustments. In our office, we use various forms and techniques to adjust. Some techniques are about the same pressure as testing the ripeness of a tomato, to more traditional techniques like the ones you see being used on professional athletes. Whatever the case is, it's personalized. No one size fits all. You are unique and deserve personal attention. So please call us and let us find out if we can help you. God bless.